Hello and welcome to the Front Row Back Row podcast. I am your host, if you're looking at the video, in sunny Phoenix, Arizona, here on this January 31st. And I'm Owen Campbell, owner of Simplified Motion Physical Therapy, and with me is Dr. Brian Wolf in a much colder place in the world.
Colder and sicker. Everybody's sick. As
Oh
you were
yeah.
talking before. Exactly.
Yeah. The joy of having kids. I mean,
Exactly.
we went through it last week, so you're getting to pay the price.
Exactly. That's how it works. That's how it
You know,
goes.
I always thought in Arizona everything's sunny, we're all outside, like diseases wouldn't spread, but no. I think it's all you people from the Northeast coming down here and giving us your germs.
Well, that's you're included in that. You know that being an
Yeah,
originator from the Northeast.
I
So,
know.
so
We get so many people. Oh, my family was here, and then all our kids are sick.
yeah, exactly. That's how it works. And then you give it to each other. Exactly.
Yeah.
Exactly.
All
Exactly.
right. So today we are going to be talking about actually an interesting stat I read um, from actually a former Ithaca grad. Actually, if you remember Stephanie Allen, she does the ACL rehab stuff
Yeah.
out in Boston, and she posted that 55% of ACL recovery or ACL patients actually return to the normal that they wanted to, right? So this
Yeah.
is your basketball player who's told in the surgeon's office, don't worry, I got you. You'll be back playing in 9 months, right? The percentage of people that actually return to that level, that height that they were at previous to the injury, was only 55%. And I think this is based on self-reported data. So this is more, asking patients, how do you feel? Not so much actually looking at like their stats on the field, right? And it got me to thinking. I really wanted to talk about this because I think that stat is kind of nuts, right? Like one in two people, 50%. It's almost a coin flip. You get what you want out of it. I mean, is that something we give this to professional athletes all the time? Like it's like, oh, yep, you just need an ACL, go for it. Something that's 55% effective. Like what so that's why I wanted to talk about it. I know
Yeah.
you at Evolution, you guys see this stuff all the time with ACL recovery and return to sport, especially in your the teams that you guys support. So I was just wondering, I kind of want to throw it on the docket. Let's talk.
Yeah, man. I think the stat that I heard a while back was I heard that it was 66%. So it's interesting you heard the 55%. I remember a doc at HSS told me that like go 2 out of 3. And I remember he was a little bit like he's like, oh, but mine are higher. And I was like, it has nothing to do with the
Always.
surgery. I mean, the surgery. I shouldn't say that. The surgery. There is an aspect of the surgery that does matter, right? In terms
Hmm.
of double bundle, single bundle, how the thing is positioned, blah 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 blah, all that stuff.
Yeah.
Um, but I think you see a series of different stuff, right? I actually have a professional athlete who just had his ACL last year, and
Yeah.
and this is a high level soccer player. Used to play in Italy, right now is in the MLS,
Hmm.
and had this happen, and we'll be part of that rehab, of course, the entire way. And
Right.
the reality is, there's these when these things happen, they're in all varying degrees of person.
Hmm.
Um, you know, when you think about certain athletes and where they are in their journey in terms
Hmm.
of like professional sports, high school athletics, college sports, whatever, um, I think the biggest thing is the fallout afterwards, right?
Hmm.
So this rehab isn't done correctly over what I believe to be a 9 month span.
Hmm.
Hamstring, soft tissue injuries, quad injuries, calf injuries, different type of explosiveness, the proprioceptives type of issues, the power that they lack, in general, the fear. There's fear factors with all this stuff. These all play into that. So the
Yeah.
problem about this is it's so multifaceted that ultimately it's not shocking to me that it's 55% that
Yeah.
it's that high.
And I agree with you. That was the first thought I had, was that because this is a rehab that needs to be intensive in the first few weeks in terms of managing swelling, getting your quad back to where you need to be, all of those kind of post-operative metrics that if you don't do them well early, right, you regain extension the first week, you get that quad firing, long arc quad stuff, all that. Um, is bad, right? If they don't do that well, sadly, I think a lot of us have had that post-op ACL at 4 months who comes in and they have a terrible quad set, and you're
Yeah.
just like, oh, buddy, dude, I'm sorry. That's tough. But like you said, it's a lot of it has to do with how do they react in immediately fast-paced, high hectic environment in sports. I mean, that's how they injured it, right? They were
Yeah.
tired at the end of the game. Their knee buckled. They weren't thinking about it. They're thinking about what was happening, and the ligament gave. So focusing on that is something that is, I think, almost or more important than the first few months. So yeah, I think it's a hard stat to kind of pin down because, like you said, the rehab is so
Yeah.
important.
I already have a bias, but I'm curious to see what you think. Do
Mm.
you think that the first 4 weeks out of, like, or the first 4 to 6 weeks out of rehab for an ACL matters more about us or the surgery?
Well,
Surgeon,
I
I should say.
mean, obviously, an infection would screw all that, right?
For sure.
So if that happens, I think the thing they would always say to us is like, if an infection happens the first 2 weeks, it's the surgeon's fault. After the next two
Yeah.
weeks, it's everyone else's fault, right?
Yeah.
But I I don't know. I mean, it's hard because you have some people that just naturally are very well developed legs, great neuromuscular control. They get their quad set just by having a cough, right?
Yeah, for
It
sure.
it
For
just
sure.
happens out of nowhere. And then you have others that maybe aren't. Um, I would say that first 4 weeks has a lot to do with how the surgery was done, right?
Yeah.
Because it's an acute recovery from. I mean, let's face it, surgery is an injury, right? So it's a trauma. So yeah, I think that has a
Yeah.
lot to do with it, and the graft healing has to be pretty good there. Obviously, if you tightened it too tight, you could have a real rough first few weeks.
Yeah, I kind of agree with you. I think the longer the rehab goes on, the more it's us, right? As physical therapists,
Oh yeah,
I think that the closer to the surgery, like to your point, and I think the one thing that's interesting, and this is not for me to talk badly to surgeons because I've seen it all, right? Good
yeah,
outcomes, bad outcomes, and I
yeah,
actually think good outcomes and bad outcomes aren't indicative of what the first 4 weeks are. I think obviously it makes the rehab road a lot less bumpy if they're good versus not.
yeah,
However, on the flip side, I think when you think about, um, those first 4 weeks, I think we can make a bigger impact than we ever thought we could before.
mm,
BFR, right? Any type of like stim
yeah,
stuff versus like any type of like again.
yeah,
The argument about ice versus not ice drives me crazy. But in terms of,
yeah,
some of the stuff when it comes to how to do the rehab, I think it's that crucial, like 3 to 9 month period where it's
yeah,
so important for us to be. And again, wasn't a happy triad?
yeah,
Was an ACL solo? Was it, was there a meniscus that needed to be repaired versus a meniscectomy? Was there a,
yeah,
again, what other ligaments were involved, right? Like what was the graft, right?
yeah,
Quad. Was it
yeah,
a because the quads become big now, the hamstrings
yeah,
versus the patellar tendon. I was the guy screaming forever that I was never the biggest fan of patellar grafts because
mm,
while I know they're stronger, I definitely found I felt
yeah.
like I found anecdotally a higher incidence of patellar tendon
Well, yeah,
issues.
patellar pain is like the number one issue
Yeah.
in that sort of 3 to 6 month window.
Yeah.
Is you got a guy who's like, or a gal who's like, I can do this. Look at me. I can walk. I can squat. I can put some weight on the bar now. Look how good I am. Let's go running, jumping, cutting. And they got some patellar pain. And this is, I agree with you. So first off, prefacing this rant with, yes, it is on us after about 6 weeks, right?
Yes.
Where it is, you really can't say, well, it was a bad, no, it was a bad recovery at that point.
Yeah.
So if you have, some of these guys jumping around and they're like, well, I got some knee pain, but that's okay. I'm like, no, it's not, because that
Yeah.
inhibits your quad. And your
100%.
quad, look at Saquon's quads 1 year out and 2 years out. Massive difference,
For
right?
sure.
And he's going to be one of those that would he be 55% return back to normal or not, right?
Yeah.
So, those, I think that's the difference is that at that 6 week to 3 month mark, depending on, the athlete, onto their first step across the baseline, right?
Yeah.
Onto the field of play, that's on us, right? And
I think
that's where it's important.
I think too, something just to clarify more than what you just said was the 55% back to their normal,
They're
right?
normal. Yeah.
I
Well,
think
Saquon
too.
finally got back to his normal, right?
Yeah,
So
man.
he's on the plus side of that.
And I think there's a reality of this. Like I ask people this all the time. I go, when it comes to work with professional athletes, right? Do you consider their normal, right? So,
Yeah.
one of the things, and I'm gonna go after us a little bit as a profession in physical therapy. I find a lot of physical therapists, And this talks to the cash pay breakout of some of this stuff and the insurance part. And I talk with our guys all the time, like, don't be afraid to do this rehab for 9 months, right? Like,
Hmm.
this is
Yeah.
important. We have systems in place for this person. I don't really
Yeah.
care if, like if their insurance pays for the whole thing, incredible. That's awesome. If it doesn't, but
Yeah.
we have a quality to uphold. And
Yeah.
so I think what's important about that stuff is we have fitness based programs within our organization that allows us to do that, along with
Hmm.
us being involved in that with physical therapy, right?
Yeah.
And so it's so important, from a standpoint of individuality and also where their prior level of function is. If someone discharges early for a reason that isn't that the
Hmm.
person's 100% better, then that's
Yeah.
a problem, right? And I
Yeah.
don't care
The
what the heck that is.
Yeah, the 15-year-old basketball player whose parents work a 9 to 5 and it's only
Yeah,
insurance or nothing, right?
yeah,
Who's got 3 times a week for 3 months and now has no insurance left because they, probably overutilized in the beginning, right? Um, that person would benefit obviously from being able to have the financial wherewithal to be able to go forward, but as the PT you got to manage that in the beginning,
yeah.
right? You got to know the insurance, you got to know what they're going to be allowed. And then the ideal world is, from a obviously from a ability to pay for the services, be able to kind of transition into that more fitness, maybe a subscription model type of mentality where the person who's taking them through the fitness classes is either a PT, right, who's
Hmm.
coaching the class, um, or a trainer that is employed by PT that
Yeah,
gets trained by the PT. There's a lot of different ways you could do it, setting up as like as a business, but
yeah.
I think you have to plan for the long road. You can't
100%.
be afraid. You can't be afraid that they're going to just get denied and be like, "Well, okay, I guess you're fine in 3.5 months."
Well, that's that, and unfortunately, I think that's a crutch that physical therapists have tried to lean on in the past,
Yeah,
that I think is terrible, right? And I think for what
yeah,
we've done, and again, we're an insurance based taking company, and I'm proud of that. We do a
yeah,
really good job of managing these things, and
yeah.
I would venture to guess that 80 to 85% of people are covered throughout the full recovery.
Hmm.
And I bet people are gonna. I bet this would be a comment below that people are gonna be like, "What insurance?" And the reality is like it's just a matter of figuring it out and knowing it. I find the
Yeah.
problem is most people don't understand how to navigate that process properly.
Hmm.
and
Yeah.
and on the flip side, to your point, also having other alternative avenues to go through the full rehab properly, because
Yeah.
when it comes to jumping and hopping, and I remember, I'll never forget this. When I was a young student, when I was a student in a hospital once, I remember something very specifically, and it baffled me. Was I was in a meeting at a hospital on one of my rotations, and they were talking about how they treated everybody based off of Medicare guidelines.
Hmm.
And so Medicare guidelines said when you can do X, Y, and Z, you have to be able to, discharge. And so this
Yeah.
guy said, well, what about all my ACLs? I have to discharge all my ACLs. And in my head, I was like, why would your ACLs be on Medicare? But the hospital's policy was
Hmm.
based off of Medicare stuff. So they
Yeah.
were discharging ACLs 6 to 8 weeks out. And I was like,
Dang.
that is crazy. That has nothing to do with
That is
insurance. That has nothing
that
to do
is
with insurance.
insane.
That has to do with the
Yeah.
hospital. The hospital's terrible. Just so we're
Risk
clear, that is
mitigation.
a bad hospital. That is not a good one. So when
Yeah.
you think about when you
Yeah.
think about that, people, I think oftentimes, then what ends up happening is there are people in that model that are like, oh, insurance is terrible. I should go to cash base, or I should do this. And the reality is like that had nothing to do with any of that. That had to do with
Yeah.
the people not understanding how to make this work
Mhm.
properly.
Well, and look
And
at
it's laziness, in my opinion, right? More than
yeah,
anything.
exactly. Look in the mirror, right?
Yeah.
The therapist, you're on a PT podcast. PTs are awesome. Man, please listen to my stuff. Honestly, a
Yeah.
lot of it probably has to do with there's a PT out there. It's like, oh, okay, whatever, it's an ACL. Let's like bend and straighten and I don't know, maybe we'll squat this week.
Yeah, man.
Whereas what you really need, and I mean if any patients are listening to this, you got to find a PT who knows what they're doing with sports if you have an ACL reconstruction, because it is, if it's not planned for well early, right? I agree with you too, by the way. Like, in my experience, I've usually been able to talk to most insurance companies and say, like, hey, give me
Yeah.
5 more visits. I'll go once every 2 weeks so that we can hit the markers and the training at the specific times that he needs. But of course, I planned for that because I didn't tell the guy he had to be there 3 times a week doing heel slides while I watched him, right?
Yeah.
Um, so it's, I think a lot of it, the mirror has to be turned back on the PT.
100%. I think that's the part of like, so when I think of like the way I split this all up, right? Like, I think of my important months of an ACL is that 6 to 9 months, the return to
Mm,
sports side, and like how to be very specific with that.
yeah.
And when I'm being more specific, it's like, all right, this is the type of training that we're going to be doing. Here's how we're going to do it. Right. And then also, I mean, again, we have a lot of other cash based services that we provide. So, like,
Yeah.
that's something where it's like, here's how we're going to deploy those. And so, how we're going to utilize those to either increase the volume or
Hmm.
increase the intensity in some capacity. Most of the time, we don't have to deploy them right off the bat. So, it's like, it's nice to have that. But I think in terms of how you can do an ACL through a 9 month rehab, I think my experiences is that most physical therapists struggle to program that. Like, I would challenge any physical therapist to sit down and write down for 9 months. If you had to
Hmm.
see an athlete 6 days a week for 9 months out of post-op ACL, what would they do every single day?
Yeah.
Right. And the reality is
Yeah.
that's what I do in professional sports, right? Like that is
Yeah.
what we do in
Oh,
professional
yeah.
sports. So
Yeah.
to that point, when someone's like, well, why would I ever do that? It's like, that's what I do it. I do it every day. So I do.
Yeah.
So from that perspective, like this guy's next 9 months. Now I can tell you there's an A and a B and a C day, and those
Yep.
things can change. And there's they can progress. And here at this mark, when they hit this benchmark, we change here and at this. And so it's like, that's how to make sure that you're constantly doing good return to sport rehabs. And in my
Hmm.
opinion, probably 45% of, it's based off that statistic of 55%, 45% of people are not getting that treatment. And so
Yeah.
therefore that's where that statistic would come through.
Well, it,
Or they're not seeking that somewhere.
yeah, or even if you're not dealing with professional athletes, but just who would be considered elite athletes in a lot of the studies we look at,
Mm-hmm.
your Division 1 athletes, maybe they have some school support, but not, enough that it's 6 days they're paying you to be there, right? Um, Programming, like communicating, saying on this Tuesdays and Thursdays you'll be in my clinic, or Tuesdays you'll be in my clinic, but on Wednesday, Thursday, Friday, Saturday, I want you doing recovery day one day, then arms and core the other day, then we'll hit legs hard, then you'll do jumping, cutting, plyos, whatever. It's extra work, and I mean, to be fair to the struggling PT with 10 patients, before noon, it's a lot of extra work, right?
Yeah.
So it's something though that if you get good at it and if you work on it, it can become more habit, right? And then you're just like, okay, this is what you're doing. We're at 6 months, we're at 7 months. This is, and then go from there. A lot of that has to do with clinic culture, right? Whereas
Yeah,
this
for
is the
sure.
expectation. This is the expectation of what we're going to give somebody with an ACL. Um, so it's a lot of it is the soft, squishy stuff, not just like they got the surgery, they were happy or not.
Yeah, man. Yeah. I mean, a good tip that I would tell any physical therapist is
Yeah.
write that programming out for that 9 months,
Mm-hmm.
right? And then just use it. And then guess what? You have it forever. So
Yep.
to your point about like the PT that does have, works in that system where they got 20, 25 patients a day,
Yeah.
if you write that program out once, it's a lot. I'm a big believer in doing a lot of front loaded work that can
Yeah.
be repetitive. We
Yep.
have programming. One of my guys, one of our strength conditioning guys is awesome. He wrote out
Yeah.
like 40 different programs. It was
Yeah.
crazy how many programs he wrote. And I was like, oh my God, but they're done. And we have them all in a system where they're done. So
Mm-hmm.
now we can just like, oh, you're a football team, bang. Oh, you're a football, like it's done. Like there's no
Yeah.
other program that needs to be done. And the reality is we can just tweak it along the way. And again, you can
Yeah.
program in your mind, yeah, those first, if someone's like, oh, precautions, yeah, those first 3 months got to be modifiable, but not
Yeah.
that much. And the reality is,
Yeah.
at 3 months plus, it's not that much. It's not that
No.
different. And again, there's a difference between having programming set and modifying
Mm-hmm.
versus anything else, right? And then
Yep.
that's where data driven stuff comes in. So like we do stuff with GPS and those analytics and force plate analysis
Force
and
plate
whatnot,
stuff. Yeah.
and that stuff's awesome. And so when you have that, you can actually test and retest and have objective testing, that also allows you to know what you're doing is being effective. And
Yeah.
so you can also see where like when someone's like, oh, well, then you do your programming once. I'm like, I mean, I know my stuff works because I'm doing it the
Yeah.
highest level you could possibly do it.
Well,
So
and
those are important.
think about too for the busy therapist, right? If you could hand an ACL reconstruction patient a new, here's my list, this is what we're going to be doing, these are the things that you should be expecting. Yeah, that's a big comforting factor to that patient, right? They went through this big thing, they're wondering, is their sports career over? And the fact that they can walk into your office and get something like that, where maybe you hand it to them or not, maybe you just show it to them, right?
Yeah.
And say, this is where you're going to be, this is what my athletes do. That's got to be way more comforting than just, oh yeah, okay, get over there, we'll throw a hot pack on you.
Yeah, man. I mean, I'm used to like it's funny because I was just doing this to your point. I do this at a professional level, right? But I was just with
Yeah.
a 17-year-old soccer player who just
Wait,
committed
wait,
to
wait,
go.
hold on, hold on, hold on. Do you do things at a professional level? I don't know if we heard that two or three other times this.
Yeah, just a plug. I'm awesome. All right, so good. So in terms of like I had a kid who's like 17, and we
Yeah.
were chatting about it, right? Because he was like he had a meniscus repair, so a little bit
Yeah.
different, obviously, when we're talking about ACL, but it's a similar timeline, right? And
Yeah.
I was like, here's where you're going to be month one. Here's where you're going to be month two. Here's where will be month three. Here's where I expect to be month 4, 5, 6, 8, and so on. I go, and then when we talked to coaches, the coaches are like, hey, will he be back for this time? And I'm like, no. And
Yeah.
they're like, you sure? Blah, blah. I'm like, no. Right. It's like, and he knows that. It's like, because there's just a system in place. It's not
Yeah.
wishy washy. It's not like, hey, I'm not sure. Hey, I don't know this. Like all that research on what the
Yeah.
best outcomes are, again, it's done. Once you have it all
Mm.
fixed, it's finished. So that process is so key, because once you hammer that in, and I think if more people had that process, this number would not be 55%. It'd be
I agree.
75%, 85%, 95%.
Well, and think of all the work you talked about. Think of all the thinking that you did to get you to that point, and then eventually to a point that's it's I don't want to say self-sustaining, but like have something that you can point to, right?
Yeah.
That can be massively valuable as a clinician if you get to be known as the ACL guy in your neighborhood or the ACL gal in your neighborhood. That I mean, God, every person that walks through your door is going to be with you for 9 months. I mean, when the average length of stay in physical therapy is what, like 9 visits, right?
Yeah.
That is massively important from everyone from the the staff PT who's trying to just make sure that their caseload's fun stuff that they want to deal with, right? All the way obviously up to a business owner who sees the dollars and cents of it. So
Yeah.
I think it's really important, and also it could be very beneficial to get known as being the person in your neighborhood. But I guess I want to know, because this would be great. I'd love to have this business walking through my door down in Phoenix. What are some of the things that get you known as that guy, right, or that gal, like that? You're the niche. Is surgeon communication, having good relationships with them? Is it more like just having great results over a period of years? Like what are some tips you can give me for that?
Yeah, I think when it comes to, like, say you want to niche down and be like, I'm just going to do ACLs, right? Or I
Mm-hmm.
want to do sports specific stuff in general. Like, let's use ACL as a component. I
Yeah.
think the bigger thing that's important is what you're going to want to do is I mean, surgeons are going to be helpful because obviously they're doing the surgery. But
Yeah.
obviously, if you're like me in any other place, like those physician, owned physical therapy practices are going to be gobbling those things up. But I can tell
Mm.
you what is happening. That
Yeah.
55% most likely has become a lot of those places, because what's ended up happening is at 3 4, we had somebody who just came on with us who was like, I'm sick of losing my ACLs at 3 4 months because they can't go and do the return to sport phases. So if
Yeah.
you're really good at the 3 to 9 months, in fact, she jumped on with us because of that. I was like, they come here, this is where they go. So the other part that you could do is you get out in the community and you talk with specific sports teams that are high in ACLs, right? So
Yeah.
like, we know that soccer is going to be big in that, right? We
Mm-hmm.
know that football, right, is going to be high in that. We know that
Yeah.
there's going to be ACLs in a lot of female sports, particularly between 14 and 18 years old. Like, so we know these are niches that are going to have that.
Yeah.
So what you can do is you can get involved with those places and give these talks on all the aspects of prevention for ACL, but also the rehab and also the return to sport. So I
Yeah.
think what's important is kind of looking at the multifaceted community based, and then
Mm-hmm.
any of your social media contents around that, right? So I
Yeah.
think about it all the time. If my perfect patient is this like ACL, I want my
Mm-hmm.
website to talk about me doing ACLs. I want my Instagram stuff and Facebook and TikTok and whatever that is going like that. And you're going to want to do
Mm-hmm.
TikTok. That's another good, there's a good little, another podcast we talk about is market media match. TikTok is your 14, 18-year olds, right? 22-year
Yeah.
olds. So like, that's
Yeah.
where you're going to want to be on that social media platform. Don't
Mm-hmm.
go on, LinkedIn and be throwing that ACL stuff out and expecting kids to see that stuff, right?
Yeah.
Maybe their parents, right? In that way,
Mm-hmm.
we are associated. I'm like, again, for me, and why we see a lot of these post ops like this is not just our like knowing surgeons, down to my clinic looks cool for ACL, right? Like
Yeah.
I got open
Yeah.
space and squat racks and turf and
Mm-hmm.
open fields to boxes to that kind of
Yeah.
stuff to when it comes to like even doing stuff in people's homes, like that still doesn't matter because ultimately I'm trying to like, again, I do stuff in professional soccer like we have mentioned multiple times, right? I've done
Mm-hmm.
stuff in lacrosse, right? So like
Yeah.
that's huge. Then I get involved in high school, so I'm
Mm-hmm.
doing training for those people, along with also the rehab side of it, and then we do the athletic
Yeah.
training services for that process. So we're like, there is no way for somebody to tear their ACL and not hear my name somehow. And
Yeah.
that's the tip I would give anybody.
Okay.
Don't worry about, a lot of people think, hey, go to the surgeon who does ACLs, and like, yeah, like go and do that, but realize that you're competing with 50 other people doing that. So
Yeah.
when that happens, it's a lot harder when you're, particularly when you're smaller, to do that. I found
Yeah.
more success in that now. When I first started, not so much. Now
Yeah.
I can swing myself around and be like, hey, just so you know, right? But
Yeah.
again, you're competing with me now. That's the
Yeah.
problem. So like the issue
Yeah.
is, as you're coming up, that's an issue.
Okay. Yeah, and that's what I'm finding is just you got to know the people, talk to the people, um, and have your content kind of say, hey, I'm good at this, right? Because no
Yeah.
one's gonna know unless they do. Um, so yeah, that's great. I think that the biggest takeaway I have from this conversation is that this is one of the ACLs and ACL reconstruction is one of the few places where it really is on the therapist, the quality of the therapist, the quality of the therapy, how they manage the case, right, from beginning to end. And if you get really good at it, you could see a lot of it, right? Um, so I really enjoyed our discussion today. Anything you want to add before we sign out, Brian?
Yeah, man. I think this is awesome. I think we should do more of this stuff. We were just talking about how like we want to do more clinical talking and specific. I'm curious. See, people should leave comments below if they want to like more technical breakdowns of these things.
Mm-hmm.
We can start doing research stuff, but I also don't want people to be like halfway through this thing. I think it's fun to keep kind of our experience into it also. But yeah, no, I think this is fun. We can do other topics like this also.
Great. All right,
Cool,
man.
man.
Well, have an excellent Wednesday.
You too, man. All
All
right,
right.
see ya.
See ya.